Integrated care is the systematic coordination of physical and behavioral health care. The idea is that physical and behavioral health problems often occur at the same time. Integrating services to treat both will yield the best results and be the most acceptable and effective approach for those being served. I would actually go beyond this, because you'll find definitions of integrated care that talk about trying in the same setting to meet physical, behavioral, and psychosocial needs, because that's the way people come to us. They don't come parceling out their needs. And so trying to provide services that assess what's necessary and provide it at the level you can, in the setting you can, is really the most effective way to do it. It's frighteningly commonsensical at the end of the day and very patient-centered. And as a physician, I will acknowledge that the medical field has been not very patient-centered over many years, and is slowly, in this kind of a setting, coming around to some of that work.
Thank the council for inviting us to tell you more about the story of PACE, because it truly is a collaborative model. And I spent most of my years in a large, complex health system, and I'm here to tell you that PACE is probably the best kept secret in healthcare. And PACE stands for Program of All-Inclusive Care for the Elderly. I'm going to tell you a little bit about the model, and then Dr. Graddy is going to go into more depth around some of our outcomes and provide you with a case study. So again, Program of All-Inclusive Care for the Elderly. We are a not-for-profit company that is owned by Henry Ford Health System and Presbyterian Villages of Michigan. And we serve frail seniors who wish to stay independent in their home. There are regulations for the population that we serve. Typically they are Medicare, Medicaid eligible. They are 55 and older, although our average age is closer to about 82 to 84 years old, but we do see them coming in younger. They need to live in the service area that we provide services for, and that's really authorized by the state. And we serve Wayne County, Southern Macomb, and Southern Oakland County. So those are the areas that we serve, and we have 2 sites, and I'll tell you more about those in a minute. And they need to be safe in their home. Safe in the home with the supportive services of PACE.
So when we talk about why for PACE the integrative care model works, is because there is true integration. And the integration involves not just the medical aspect of the care, but it involves the psychosocial, the mental, the environmental, as well as the financial aspect of care. And when you put all of that together, we have the ability to be innovative about what we provide. Next slide. So when we think about where the population is going, so when you think about the demographics, we know probably in the next 15 or 20 years, some 30% of the population will be 65 plus. And what that means is the population continues to age. The medical conditions for this population will increase, disabilities, chronic disease, and therefore hospitalizations and the cost of medical care.
Community Care is a federally qualified health center in Detroit. We have 6 locations. We provide medical, dental, and behavioral health care. Behavioral health primarily through Southwest Counseling Solutions, a community mental health center in Detroit. You know, as we were seeing some of the great slides on integrated care, patient-centered medical home is a theme for community health centers and for the healthcare primary care field right now. And I think that it just popped in my head that the opposite of that might be payer-centered medical home, which is what I think we typically have, a payer-centered medical home. And so you see care organized around what the payers want it to look like. And providers figure out through big and small ways how to reorganize. You know what? We can't do it that way because they don't pay for that. Or we can't do it that way because so we have disintegrated care because we like it. We want disintegrated care. That's why we have disintegrated care.